Hi everybody, welcome to my YouTube channel Dr.Sreenivas Medical Concepts and my FB page Dr.Sreenivas Concepts. This is Dr. Sreenivas, neurophysician from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the two books Focused Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. Today we are going to discuss an interesting topic, the primary sensations and their neural pathways. Primary sensations and their neural pathways, concepts of sensory system, part 5. So how do we test these primary sensations? So the sensation tested and the device which we use. For pain, the test device is pinprick. For temperature, heat, it is warm metal object we use as test device. For temperature cold sense, the test device used is cold metal object. For the sense of touch, the test device used is cotton wisp or fine brush. For the sense of vibration, the test device used is tuning fork with 120 Hz. The sense of joint position, the test device, how do we perform and how do we test it? Passive movements of specific joints. So for sense of pain, the test device is pinprick. Temperature heat, warm metal object. Temperature cold metal object. Touch, cotton wisp or fine brush. Vibration, tuning fork 120 Hz. Joint position, passive movements of specific joints. Right. So types of sensations and neural pathways mediating it. For pain and temperature, it is the spinothalamic tract. So pain and temperature, heat and cold are mediated by small fibers and spinothalamic tract central pathway. The touch is mediated by both large and small fibers and posterior column and spinothalamic tract central pathways. Whereas vibration and joint position are mediated by large fibers and posterior column central pathways. So pain and temperature on one hand is mediated by small fibers and spinothalamic tract central pathways. The vibration and joint position sense on the other hand are mediated by large fibers and posterior column central pathways, whereas touch is mediated both by large and small fibers and posterior column and spinothalamic tract central pathways. So these are all the important concepts of types of sensations and neural pathways mediating it. I hope you have enjoyed listening to these concepts. The other important concepts of clinical neurology I have put in a book, Exam Oriented Clinical Neurology, written by me, Dr. Sreenivas. This book contains all essential clinical neurology material which will be very useful for students appearing for clinical neurology exams. The other book I've written is Focused Neurology, wherein I put all the important concepts of neurology in a question and answer format. This book will be very useful for students appearing for Viva and orals. This book is available online from all leading booksellers including Amazon. So if interested, this book could be purchased online. I hope you have enjoyed listening to these wonderful concepts, and if you have enjoyed it, please like and share the link, but please subscribe to my YouTube channel Dr. Sreenivas Medical Concepts and my web page Dr. Sreenivas Concepts. Thank you. Bye.